thank you all for joining us this evening for NAMI Maryland's Voices of Experience Frontline Wellness Program. Before we get started, we wanted to note just a few housekeeping points. To avoid background noise, all participants will be muted for the duration of this event. If you have any comments or concerns during the event, please enter these into the questions box, which is located on the right-hand side of your screen if viewing from a computer, or at the bottom of your screen if viewing from a phone. We will review and address any immediate needs as they occur. A recording of this event will be emailed to each registrant tomorrow. The recording will also be available on our website at www.namimd.org for any individuals that were unable to register. After the event today, you will be asked to complete a short survey on the aspects that you felt were helpful, could be improved, and what you would like to see in future virtual events. We plan to continue hosting educational webinars and events like Voices of Experience, and we ask that you please fill out this survey to let us know how NAMI Maryland can best support you during this time. Now I will hand it over to our Executive Director, Kate Farrenhold.
Hi, everyone. I'm so happy to be here and so happy to see all these wonderful people who are going to present for this evening. If you'll give me 1 second, I have multiple things on my screen and I'm trying to pull up. There we go. Thanks. So thank you for joining us. My name is Kate Farrenhold. I'm the Executive Director of NAMI Maryland. I'm joined today by JB Moore, the Executive Director of NAMI Prince George's County, and our board member, Gertie Wilson, who will be our moderator for today's event. The National Alliance on Mental Illness is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. NAMI operates at the national, state, and local level. We serve the individuals and families directly affected by mental illness, the many people who care for and interact with them, and the wider community. Healthcare and first responders are on the front line. They interact with, care for, and yes, they advocate for those of us who are directly affected by mental illness. They make a difference every day. Frontline workers face many challenges in their day-to-day work life, from the pressure of making sure that people get the help and care they need, to working long shifts. Healthcare and public safety are stressful fields of work. For many frontline professionals, the pandemic has taken a toll on their mental wellness. NAMI is here to help. We've joined the National First Responders First Initiative to support frontline healthcare and public safety workers facing the adverse mental health effects of the COVID-19 pandemic. This community-centered initiative is called NAMI Frontline Wellness. May is National Mental Health Awareness Month. It is a time to raise our voices together to advocate for mental health care and access to that care. Today, together we can realize our shared vision of a nation where anyone affected by mental illness, no matter their identity, can access the appropriate support and effective care to live healthy, fulfilling lives. To celebrate Mental Health Awareness Month and the Frontline Wellness Initiative, we're excited to partner with NAMI Prince George's County and the Prince George's County Office of the County Executive to bring you our Voices of Experience event. Tonight's Voices of Experience focuses on, yes, frontline wellness. This free virtual program will feature frontline workers who will share their personal stories of resilience, adversity, and hope during these difficult times. Today, we would like to honor and highlight the stories of these fearless frontline healthcare workers and first responders and invite them to share their experiences with us. Now I would like to hand it off to JB Moore, Executive Director for NAMI Prince George's County, to say a few words.
Thank you, Kate. Good evening, everyone. As Kate mentioned, I am JB Moore, Executive Director for NAMI Prince George's County. I am honored for the opportunity to share a few program highlights and then welcome our special guests. In Prince George's County, NAMI as a movement is thriving. Here, the movement is fueled by the personal and traumatic experiences of Prince Georgians impacted by mental illness. Such personal experiences are used to engage others in positive action to create positive change. Our mission is achieved every time this positive change results in improved quality of life for individuals and families impacted by mental illness. With the help of our passionate and dedicated board members, staff, consultants, vendors, donors, and other supporters, NAMI Prince George's County plans and implements all peer-led, many evidence-based mental health education and support programs and provides them free of charge to participants. Our classes offer information, resources, and community support. They help increase understanding of mental health and mental illness, improve coping skills, and empower participants to advocate for themselves and their loved ones. NAMI presentations offer audiences the opportunity to hear stories of direct experiences of the impact of mental illness on individuals and their families. Our presentations help to create awareness, reduce stigma, and increase empathy. NAMI support groups offer participants an opportunity to share their experiences and gain support from one another. Generous support from local government allows us to conduct outreach to the elderly and provide valuable training for those who care for them. Local government support also allows us to conduct outreach to frontline workers, returning citizens, and transitional age youth during a time when critical mental health support for these vulnerable populations is most needed. Our message is clear. You are not alone. Hope is possible with help, and treatment works. Finally, NAMI supports public-private partnerships that seek to provide mobile crisis response services in Prince George's County and focus on improving the county's overall healthcare system. And now I have the distinct pleasure of welcoming our special guests. NAMI Maryland and NAMI Prince George's County are grateful to have support for this critical project from several local decision makers, and we're honored to have them join us this evening to share a few words. Please join me in welcoming Dr. Molina Shaw, the Medical Director for the Behavioral Health Division of Prince George's County Health Department. Dr. Shaw is board certified in addiction medicine, child and adolescent psychiatry, and adult psychiatry. We're also glad to have two prominent leaders from Prince George's County here with us tonight. Delegate Charles is the chairman of the Prince George's County Delegation, and Delegate Fisher, the Prince George's County House Delegation Democratic Caucus Chair. Delegate Nick Charles is a graduate of the University of the District of Columbia, an Air Force veteran, and a proud father of two. A lifelong Prince George's County resident, he was elected to serve the 25th District in the Maryland General Assembly House of Delegates in 2018. In November 2021, during his freshman term, Delegate Charles was unanimously elected by his peers to serve as chair of the Prince George's County House Delegation, the second largest county delegation in the state. Delegate Charles champions quality health care and procurement legislation and serves on the board of directors for Greater Baden Medical Services. A proud daughter of immigrant parents, Delegate Juanica Fisher's interest in politics began at an early age when she distributed petitions to build sidewalks in her neighborhood so kids could walk to school. That spirit of public service has never left her. Delegate Fisher serves as the Assistant Majority Leader in the Maryland House of Delegates and on the House Judiciary Committee, where she has been a champion for NAMI priorities. I will now hand it off to Dr. Shore, to share a few words. Thank you.
Thanks, JB. Good work getting through that tongue twister. So on behalf of the Prince George's County Office of the County Executive and Ms. Angela Also Brooks and the Office of the Health Officer, led by our Health Officer, Dr. Ernest Carter, I want to thank NAMI and specifically JB Moore of NAMI Prince George's, not only for asking me to participate in this very important event, but also being such a great partner to the health department and ensuring that family voice is prominent in all that we say and do. This is an important evening because although the frontline workers are considered to be specifically those doctors, nurses, and public safety workers who are serving at ground zero of hospital emergency rooms and ICUs and on our streets, we have all in our unique ways been on the front line. I don't have to remind us that the last several years have been trying. Many of us even think about these years as a time warp, but this truly reminds me of a prime effect of a traumatic experience, such as witnessing an act of violence, forgetting. Yes, we have together, each and every one of us experienced collective trauma. And let's not just think that that trauma was the pandemic itself, but the hate and rhetoric of racism and repeated exposure to images of police brutality for many added salt to the wound of a pandemic that itself was not colorblind. Just to remind us of the impact of the pandemic by the numbers, by June of 2020, in a US survey, about 40% of those surveyed had some behavioral health symptoms. And my gut says that that number was really actually low. But nonetheless, I think the tail of the data is in the breakdown. About three-fourths of those in the 18 to 24 age group reported mental health symptoms. And a little over half of Hispanic individuals reported mental health symptoms. And about half of individuals who were considered essential workers were also affected. I read somewhere, I think on the wisdom of social media, that we should actually probably have changed that word or the phrase from essential workers to sacrificial workers, because these were individuals who have and continually sacrificed their lives for essential services in our community. And finally, about two-thirds of those in the survey who had mental health symptoms were unpaid caregivers of adults. And so when you think about the work of NAMI, and that these people could have had also mental health conditions that they were serving, that they were caring for the adults. And then a lot of those people, about 40% of those people, actually also were caring for children. And pandemic parenting brought its own set of challenges in the virtual world. So I'll share a little bit of my own personal experience during this time. While working in public health, I went into work overdrive. I saw a need and worked to fill it. But sending emails at 3:30 a.m. just became unsustainable and incompatible with my own mental health. I started seeing more and more of the signs of anxiety that I was speaking to others about, and I knew it was time to quickly enact my own coping skills and establish boundaries. Then, seeing another instance of the images of George Floyd on the ground and seeing the protests, I started to feel guilty for not doing enough, not protesting, not working on the front lines like my other physician peers who were working in hospitals. There had to be something more I could do. That at the end, after much prayer, reflection, and support from others, I realized that I could only do what I could. And being a Black physician working in a predominantly minority county, in the midst of one of the largest mental health crises that we have ever seen, I knew that my work was enough, and I was enough. Now, I can't say that I've yet found a perfect balance, but I've grown through all this. We all probably know that about post-traumatic stress disorder, but how many of us talk about post-traumatic growth? We not only survived, but this is an opportunity for us to come out stronger. By stronger, I mean more mindful of our health needs, because our health and mental health could not be ignored like so many of us did prior to the pandemic, when the stakes weren't just as high. And stronger, by stronger, I mean more resilient. If someone said 2 years ago that all of this would happen, we would have laughed it off as a sci-fi movie plot, but we made it. And by stronger, I mean more hopeful, because we have seen the depths of the dark and cold days of isolation where we were numb to death counts. But we have also seen days where vaccines and declining case counts have gotten us closer to enjoying our friends and families and our favorite activities. So today I encourage each and every one of us, myself included, to leave this event focused on how we can continue to stay on the forward trajectory of growth and strength, even if we're not totally there yet. I join you in showing gratitude to not only our sacrificial workers who sacrificed our bodies and minds, but also to all of us who collectively created a community where we could be proud of ourselves and really strive to have a post-pandemic journey of continued strength, hope, and growth. Thank you.
Apologies, we're dealing with some technical difficulties. Delegate Charles, can you hear us?
I can hear you guys. I can see a couple of folks. It's only showing two people on my. I'm actually doing this from my phone right now. But no, can anyone see me? I see actually two more people now. Can anyone
We
see
can't
me at
see
all?
you. We can't see you, but we can hear you loud and clear.
Okay. Well, I was hoping you guys could see me too, but I don't know how to make that work on my phone. But if you want me to go ahead and jump start now, I can go ahead and do that.
Absolutely.
Okay. Well, first off, I want to say good evening to everyone, and thank you for allowing me to be here with you tonight and present on behalf of the Prince George's County House delegation. Delegate Nick Charles, and I'm telling you, it's been a whirlwind of a year. A whirlwind of a year. As you all are aware, the pandemic has ravaged our communities so much so it has been a very hard time for a lot of our families, for a lot of our neighbors, and more importantly, for our frontline workers. People who have to deal with this on an everyday basis and still have to turn around and go home to their family scared of what they could possibly bring back with COVID. And so I want to, one, take this time and just give a strong round of applause and thank you to all of the frontline workers for everything that they've been doing. And NAMI, thank you all as well for the things that you guys have been doing in terms of mental health. When I first got into the legislature, that's when I first heard about NAMI, and I had a couple of friends who were in the mental health space providing clinical services. And when I asked them about NAMI, it was nothing but positive things and all of the great work that NAMI does, how you guys touch the people and how you guys advocate for policies that truly help folks. And this is a critical time where we need to make sure people get the help that they need. And that's just what we did in the Maryland General Assembly. You'll hear from my colleague, Delegate Fisher, who I truly thank for her support and voting for me to be the chair of our delegation and all of the great things she's doing for the Democratic caucus and for what we do in the General Assembly. You'll hear from her later. But we have had a phenomenal year in Annapolis in terms of everything that we've been fighting for, to make sure that we take care of our frontline workers, to make sure we address some of these critical issues with mental health. We passed Senate Bill 440, which was an emergency measure, which establishes a commission to study healthcare workforce crisis in Maryland. And a lot of you all already are aware. This crisis and this shortage, when you don't have enough nurses, you don't have enough doctors, you don't have enough folks within the medical profession to be able to provide those services, it's forcing a lot of you all to have to be there double time and providing too much time and not enough time with your families. And so we have to figure out how to fix this issue. And so Senate Bill 440, which is an emergency measure that established the commission to study this workforce crisis, is something that we are proud to have passed so we can focus on this crisis. And in addition to that, we've established some loan assistance repayment programs. I put a bill in with the help of SEIU to help our nurses. Because of this national nursing shortage, we need to make sure that we are creating opportunities for healthcare workers to want to come into this workforce. But if you know that you're going to have student loan debt that you can't afford to pay, and then turn around and work crazy hours and not even be able to spend time with your family, that is not a workforce that people want to go into. So we had to do something about that. And that's why I was proud that we were able to get House Bill 975 passed, which is the nursing loan repayment program. And so we got that taken care of. There's already $50 million approved for fiscal year 2023 so that we can address this particular issue. We also established another bill and passed that, House Bill 97, which is a work group on Black, Latino, Asian American, Pacific Islanders, and others who are underrepresented in the behavioral profession and the behavioral health profession. We know within the Black community and with other communities, people want to go see mental health providers. They want to make sure they're seeing mental health providers that look like them, that they can relate to, because it's been known as a stigma for so long within the Black community and all communities really, in terms of folks really wanting to open up and express their feelings and let people know what's going on. Because there is such a shortage across the different categories, we have a work group in place to address this shortage, come up with solutions so that we can make sure we have more people participating within these particular professions when it comes to mental health. We also got House Bill 48, which establishes the Maryland Suicide Fatality Review Committee to identify and address all of these factors contributing to suicide. And we know that, that is the last place we want to see people at all. That's the last place. And so we really have to review this and make sure we have the right policies in place and the right things in place to make sure folks have what they need. We have Senate Bill 709, which also passed to establish the post-traumatic stress disorder and traumatic brain injury alternative therapies fund to support Maryland Department of Health's study for the effectiveness in improving access to alternative therapies for post-traumatic stress disorder. And if for some of you all who may not know, Prince George's County is the largest county for veterans in the entire state of Maryland. We have the largest amount of veterans here, and we have veterans coming back from war with PTSD, and it's a very real situation. So we need to make sure that we have, obviously, folks have access to VA care when they come home, but we need to make sure that we have other services out here, not just for our veterans, but also for frontline workers, because I can only imagine being in the hospital all day and the things that they have to deal with as a frontline worker, for our police officers, for our firefighters, for the folks within the jails, and we talk about frontline workers when we talk about the medical field. One of the things we end up learning during this entire ordeal is some of our grocery store workers became frontline workers. The folks within the restaurants, fast food industry became frontline workers. And we have to make sure folks have some of these things in place that can help them when it comes to PTSD and any of the issues that they've been dealing with. With all of these bills, obviously, you can hear the legislature has been working tirelessly to make sure that we address a lot of these concerns, but it doesn't stop there. It does not stop there. It takes all of us. It takes the advocacy groups. It takes the legislature. It takes the everyday citizen, and it takes the folks with some of these problems as well, so we can all come together. We can all come together and find the proper solutions to making sure that we do what we have to do in terms of mental health and in terms of making sure we protect and take care of our first responders. I just want to say once again, thank you all for allowing me to be here. I'm sorry my camera doesn't work, but I'm happy to be here with you all tonight.
Thank you.
So I guess we're moving on here. We are extremely grateful to have an amazing group of people here. And many thanks to Dr. Shaw and Delegate Charles for their support of this important program, and actually Delegate Fisher too. I'd like to hand it off now to our board member, Gertie Wilson, for the speaker portion of tonight's program. Thank you very much.
Thank you, Kate. And I want to again thank everyone for joining us this evening. At NAMI, we believe that the power of personal experience can be transformative and that it has the power to change hearts and change minds. We are thrilled to have several frontline healthcare workers with us tonight who will discuss the unique challenges they have faced throughout COVID-19 pandemic. I find it an extreme privilege to introduce these amazing frontline workers to you. Will you join us in welcoming our first speaker for this evening, Rebecca German.
Hello. I'm really glad to be able to be here with you all, meeting with you. I apologize in advance if my cats are running around in the background. I wanted to say that I know what it's like firsthand as a frontline provider, but I've been doing this not quite as long as probably the other speakers have, so I'll explain that in my story. And I currently work as a mental health therapist at Johns Hopkins Bayview, but I've only been in this role for a little longer than a year and a half. So before that, I was working in research at Kennedy Krieger, and it's hard for me to remember what things were like before COVID. I can remember a little bit about what my old job was like and what it was like to be working there when almost no one else was on site. And I can remember what it was like to transition into my current role, but I didn't know what things were like at my current job before COVID. So a few years before COVID, I earned my master's degree in social work, and I was working at Kennedy Krieger while I was in school. So I continued working there after I got my degree, continued in research and research administration. And I worked as part of a team of maybe 12 people at that time. And I was going into the office every day, Monday through Friday, feeling pretty satisfied with my career, but starting to think about shifting back into the clinical space because I missed working with people directly. I really wanted to make that difference and have that that direct contact with the people that I was making that difference for. And when I wasn't working and it wasn't COVID, I was spending time with people pretty regularly. I find that to be maybe the most important thing that I do to cope. I personally have lived with mental health conditions as well, so adjusting to this during COVID, it all kind of blends together. So it's hard to say where my feelings about COVID started and where my regular kind of feelings about life started. But I found that I was in a position to be dating right before COVID and was in a relationship right before COVID, and COVID changed a lot of things for me. The nature of my work changed quite a bit. My administration at Kennedy Krieger was forced to spring into action very quickly in order to try and figure out which research projects that were in person were safe to continue and were urgent enough to continue, but most of them shut down. And there was a feeling of uncertainty at that point because we didn't know when things were going to start up again. Most of the staff transitioned to working remotely, and I was one of the few people that chose to come into the office, not because I had to, but because I wanted to get out of my apartment with my 2 cats because I was living alone. But also because I found it to be a good way for me to get a break, to kind of compartmentalize my life a little bit instead of staying all in the same place. And as the pandemic wore on, I found out that it was all the more important to me to be working with people directly. I didn't get enough social contact with people at work, and I think that was what was holding me through to stay in the research and research administration field. So I decided to start looking for positions in clinical social work, and that's how I ended up in my current position. I was hired to work with the geriatric and neuropsychiatry clinic, which was mostly working with adults with acquired brain injuries. And some, but not all of the staff across the community psychiatry program were working in person. Most people were still working from home at least a few days a week, so I didn't really meet that many people initially. I worked with most of my patients through video or phone, so I realized how important that modality is for folks. And I'm just now getting used to mostly working with patients in person because I've recently transitioned to a new role in the intensive outpatient program. And so I'm still having challenges learning my role, learning the ropes at Hopkins, and connecting with people in different spaces now through video, through phone. But I've been managing okay, and I'm enjoying my career a lot more. And now I'm split half research and half clinical, so it's all worked out in the end. But when it comes to COVID, I'm still adjusting to living alone. I bought a house, but I also lost a relationship, and some of my friendships, while I haven't lost them, have become more strained or more distant. And I'm just now finally trying to reconnect with folks that were really close to me at one point. And the relationship that I was in, it was important to me at the time, and it ended primarily because of COVID. The person that I was with was working in a hospital setting, and they were at higher risk of contracting COVID than I was during the time before vaccines. So we decided to quarantine separately, and in the end, it wasn't sustainable. I still think about that sometimes when I think about the toll of COVID, how it's impacted our relationships and our friendships and being able to see family. I can say for me, it's led me to feel more alone, more helpless, a little bit sad sometimes. And I think this really hit me the first time when I was actually working a second job at the University of Maryland as a what was known as a PPE spotter. So before vaccines, people would suit up completely if they were going into a room with a COVID patient. And my job was to make sure that they were putting on and taking off their gear in the right order and doing it safely. And I was also in a position to be watching patients from iPads that were connected with a video feed into their room. And I remember seeing this woman come in, and she was late in her pregnancy. She was COVID positive, and she was non-English speaking. And something about that was, I think, right before I transitioned to my social work role, and it was something that made me really want to dive into helping people more, because I just realized how helpless she must feel, how alone she must feel, that she couldn't be with her family in this time in her life, that she had to speak through an interpreter in order to have her needs and wants met. And that was something that really, there was nothing I could do for her in that moment, but it helped me to realize that I really wanted to help other people. And it made me realize what an effect this has had on everyone. In terms of the job that I'm in now, like I said, it's very meaningful to me, but it's also been stressful at times. I've really enjoyed working with my clients again, but there is still a pressure to be able to see a certain number of patients. And there's still a bit of a pressure to, well, a lot of pressure to do the job well, even when I have some days limited energy like we all do. So I can say that I've experienced some burnout. I was able to overcome that by, transitioning into this new role where I have a little bit of a different role in part of my day where I can assist people with data and research. But I can say for a lot of the coworkers that I've worked with, I can see the effect that it has with them as well. And in terms of, I'm thinking about what else I want to say here. I think that since I wasn't in my current role until after COVID, like I said, I don't know much about the way things were before, but I do also believe that my patients have experienced increased stress due to COVID, and I think that our wait list has grown with more people that wouldn't necessarily have sought care coming into the clinic now, either coming back or coming in for the first time. Sometimes people that have never experienced any kind of mental health condition coming in and saying, I've struggled with this my whole life, but I've never been in treatment. I really need some help. And in terms of how how I deal with all of this stress. I feel like I would be really lost without my friends. Right now I'm with vaccines and with things starting to become safer. I do spend more time with my friends, and I found that it helps a lot with the loneliness that I was feeling, and helps relieve some of that stress. And when I'm not doing that, I engage in exercise. I try to spend time outdoors, spend time with my cats, and, you know, having those things in my life that I can use to decompress and to find enjoyment, to find meaning, have helped me to feel more grateful. And I've gotten to be used to the way things are now, but I'm looking forward to a time when we can all come together again and not feel quite so impacted by this, a time on the other side of COVID. And I don't know how long that's going to take. Like, none of us know how long that's going to take, but I have hope that before too long, things will start to get a little bit better. That's all we can really have, is a little bit of hope. Yeah. And I can say that in terms of the friendships that I've made, some of my friends I've only made since COVID. One of my closest friends is my coworker. So in the end, I have some things to be grateful for just as a result of COVID. I might not have ended up in this particular job at that time. I might not have met one of my closest friends who's my coworker. I might not have bought my house because I might not have wanted to be in a different space. So there are a lot of things that I think, even though COVID has taken such a terrible toll on all of us, there are a couple of things that I've had to find gratitude for in the midst of all of that. And I also see my own therapist. I think it's very healthy for therapists to do that, for anyone who needs it to do that. And interestingly enough, due to the pandemic, I've never met her in person. So I know what it's like on both sides. I know what it's like to be the provider on the other side of the video, and I know what it's like to be the patient on the other side of the video, which has helped provide some insight for me into the work that I do. And then just kind of wrapping up in terms of other things that I hope for, I really hope that I'll continue to have opportunities to learn and grow in this position. It's a little daunting at the moment because it's so new. And I would like to share with other frontline workers, other people who are going through this, that that we can all get through this together, as hokey as that might sound. Even when we feel like we're alone, we don't have to be. We can reach out to each other. We can support each other, especially because we understand where the other people have been. We understand where each other has been, and that, you know, this is our feelings about this sometimes seem like they're going to go on forever, but they're temporary and they'll get better. And I guess that's all I really wanted to share.
Thank you, Rebecca. Thank you so much. And you shared your heart, so we felt it. We got it.
Thank you.
We're going to have now Sarah Hutchison. Thank you, Sarah.
All right, thank you all so much for having me. I really appreciate the experience of being here. Again, my name is Sarah Hutchison. I've been a registered nurse for the last 10 years. 6.5 of those have been spent in the emergency room at MedStar Southern Maryland Hospital in Clinton. Before COVID, working in the emergency room was manageable, staffing was adequate, and our roles were well defined, and we were supported in our duties. This allowed a better work-life balance, and I was able to raise my 2 children while attending classes to receive my bachelor's degree in nursing. I was active in my child's preschool program and enjoyed social activities and vacations with friends and family. When COVID started, there was so much uncertainty in the public, my children's schools, as they were suddenly receiving their educations in my home, and work was scary as we were being faced with many uncertainties and policies that were being rapidly developed and constantly changing as the virus was new. All of life in that moment felt uncertain. I was also in the midst of a divorce during the initiation of COVID, which added to increased stress. When the magnitude of COVID became clear, there were multiple emotions, including the fear of uncertainty, lack of PPE, feelings of confusion due to frequent policy changes, fear of infecting my family members, as well as frustration from multiple conspiracies from the public regarding the pandemic. I felt like this public perception of COVID being a hoax or its magnitude was blown out of proportion, minimized our experiences. Despite these feelings, I felt great pride in the work I was doing as I knew it was helping people. I think that pride and our dedication to helping others kept us going. The social unrest in the last couple of years of COVID have been emotionally taxing. There's been so much conspiracy about the validity of COVID, which creates confusion and chaos, and it makes educating the public difficult. I feel like because I'm a nurse, friends and family always have questions about COVID, and it feels consuming and draining at times, and it's all that we ever talk about. And everyone's opinion about it is so strong. People's feelings about COVID, in addition to all the racial injustice and political issues, have created this so much division within our country. And somehow it's created this sense of isolation. And it doesn't feel like we're in this together, but it's every person for themselves. I'd like to talk about my work experiences that have taken a great toll during COVID. I remember arriving for a shift one morning to be one of 4 nurses that showed up for this shift. There were only 4 of us. 4 of us to take care of 30 people waiting in the lobby, in addition to the many who were already in treatment spaces. The 4 of us had to be ready for whatever was coming through the door at any moment. That was terrifying. I felt in that moment that I was jeopardizing my license because we lacked the necessary resources to safely care for members of our community. But the expectations of our job requirements had not been adjusted to reflect this nursing crisis, and we were expected to chart and care for patients as if we were fully staffed. This simply was not feasible, which created fear, anxiety, and frustration. Our massive nursing shortage continued, and we were all being stretched to our limits. Patients were becoming more irate and verbally and sometimes physically abusive towards us because of lengthy wait times. This all increased our fear and anxiety as well. Because of COVID and all of the shutdowns, members of our community were not receiving the physical and mental health care that they required, making them sicker physically and mentally. And we are currently witnessing the consequences of delayed care and are seeing a large rise in adolescent and adult psychiatric patients. Last October, we experienced a mass exodus, losing at least 10 staff members within 1 week. This was crushing for me, and I had extreme feelings of abandonment as I had lost the majority of my work family because there were so few of us to begin with. But at the same time, I understood the reasons for leaving, and they were being offered so much more money, thousands of dollars a week more to work elsewhere, as we were having nurses come in making thousands more than us a week. Some of these nurses that came to work in our facility lacked the required experience to safely care for our community members, which added to our fear and anxiety. As a result of the pandemic, I feel increased irritability and anxiety, as well as burnout. And I also feel that I've lost my passion for nursing, which deeply upsets me, and I'm constantly in fear of losing additional staff. And the constant turnover of travel nurses is tiring as well. I truly believe that I'm experiencing burnout. I also believe that I'm currently experiencing compassion fatigue, but I'm trying desperately not to allow that to affect my patients. To combat this fatigue and burnout, I just currently took an 11-day vacation to renew my passion through self-care. It amazed me how much I was neglecting myself. To deal with increased stress, I exercise, I speak with friends and family, and read books with positive material. As of lately, these activities have been difficult to accomplish as I'm in my last semester of school, but taking the time away from work has been helpful. I believe that prior to the pandemic, my threshold for patience was much higher than it is now, and I'm finding it difficult to interact with patients who are unruly, disrespectful, or irate. Patience is typically a strength I possess, but since the pandemic, I feel more impatient and become frustrated more easily. This ever-changing visitor policy has created additional stress for family and staff, as well as nurses who want families to be together in times of need, and it's hard on us to see our patients suffering alone. On a positive note, I think COVID has created some positive changes, telehealth being one of them, as we're able to now have initial orders placed for patients on their arrival, which helps increase patient care and reduces delay of care. I also feel that members of leadership have stepped up to ensure that we're supported emotionally. An example of this is the initiation of Wellness Wednesday. This is where we take a few moments to focus on our mental health during our shifts through various activities. Every Wednesday. This has not only increased morale, but our emotional well-being. The pandemic has also showed just how innovative healthcare systems can be and how resilient we are as humans. I believe that COVID has exposed the need for increased mental health resources, as well as the discrepancies in fair wages between travel and staff nurses. My future hopes are that hospitals begin to invest more in their staff because they are invested in their communities and hospitals. I want to thank you all for allowing me the opportunity to process my feelings through telling my story and helping to normalize mental health. Thanks for having me. Happy Mental Health Awareness Month.
Thank you, Sarah. Thank you. I'm hearing so many life changes along with the pandemic, and that is like, oh my gosh, you know. So our next speaker will be Dr. Alexander Chan.
Alrighty, thanks, Gertie. So yes, I'm also hearing those life changes, and I think my story won't be an exception. So my name is Alex Chan, and I am full-time. I work for the University of Maryland Extension. I provide prevention educational programs in the area of mental health. So I develop and implement educational programs around the state in the area of mental health. And on the side, as a part-time job, I am a marriage and family therapist. So I wear two hats, but they're both mental health related. You know, I like to be on the prevention side through my university work and the intervention side through my work as a therapist. So I enjoy being involved on both levels there. So before COVID, yeah, I kind of resonate with what Rebecca said about it's hard to remember what it felt like to work before COVID. Also, similarly to her, I had a different job before COVID. I was doing youth development programs. So if any of you grew up in 4-H, I was running that program in Prince George's County, which is also for the university. And so when that happened, you know, like when COVID happened, everything stopped. Like it's, you know, anything kid related, like there was just everything stopped. So that was a huge change for me. And actually I ended up switching jobs during the pandemic to this other mental health focused job. But personally, I was always also a very social person before the pandemic, and still am. One of my favorite things was to have rituals. You know, I like being spontaneous and doing things randomly, but I loved having social rituals and regularity of things. So for example, my husband and I would have weekly gatherings with friends, game nights, and we would go to our favorite restaurant on Friday nights. And so it was the sense of predictability that provided a lot of my mental health, that you know, allowed me to deal with the changes and the you know, the normal types of stressors from work pre-pandemic. So I was always stressed by having two jobs because I've had that for quite some time. But I acknowledge that maybe that energy expenditure may not always be sustainable for the rest of my life. But yeah, when COVID hit, it really caused me to take a long look at, you know, how I was operating. And initially, I actually felt that there was a lull in activities while everyone figured out what to do, because I was, you know, in you know, an outreach programming type of job. We all had to just sit back and figure out, like, wait, how are we going to reach out to the public? Like, I was still working for 4-H for a few months into the pandemic, and I was trying to figure out, like, how am I going to reach these kids? So, you know, of course, everything flipped to virtual. We ended up doing, like, you know, Friday afternoon, like crafting show and tell type things that we would do, and people would demonstrate stuff from their kitchens and their living rooms and stuff for the other kids to try to learn, and it was fun. But also, I think at the same time, that like novelty and fun was combined with like obsessively reading the news and things that were increasing my anxiety. And I think I'm glad that I've actually left that habit behind now. So when COVID began, definitely a lot of like ambivalence. Like there was the shock and the fear and everything, but also I enjoyed the creativity and the like problem solving and trying to reach new people through the type of prevention work that I was doing. With my therapy work, that of course increased. You know, it became a part-time job to almost like another full-time job, and that that kind of pace of how many people I was seeing every week hasn't really relented. You know, before the pandemic, I'd see maybe 7 people per week, which is like part-time for a therapist, and now I see like 10 to 12, and that's a big difference on top of a full-time job, you know, that is also mental health related. And so it's like my life became like all mental health all the time, and it was all everybody else's mental health all the time. So that was a huge factor. And so I don't think, one of the questions they asked us as we were preparing for this panel was, when did the magnitude of COVID-19 become clear to you? I don't know. Like, I was so focused on everybody else that I don't think I was really processing things, like thinking about the pandemic that hard. Like, other than the first month where I was just kind of like stopped and like wasn't really doing much, just while I was figuring things out. After that, it just picked back up to such a rapid pace that even today, I'm still trying to press the brakes. And I think that's honestly what kept me going. Like, I think I could have gotten a lot more anxious, a lot more sad, but because of the demands of both of my jobs, trying to educate people on stress management through the university, trying to, you know, do programming on maintaining your relationships during COVID. You know, I was bringing some of that marriage and family therapist background to the educational side, and as well as trying to do couples counseling virtually. Like, that was and is a immense challenge. Imagine, you know, a face on a screen trying to interrupt you as you're fighting with your partner. So it was a challenge. But I think because I was so busy, that's what kept me going. So I think as I got to, you know, in used to that like fast pace, I think I also just kind of said, well, here I am doing all this stuff. Like, I'm realizing I'm capable of doing all these things that I didn't, you know, think would be possible. So why don't I do even more? Plus and minus, right? Like, you realize your capacity, but then it's sort of like your energy fills the space that you think you have. It's like, now that I realize I can do this much, I just pushed myself to that limit. So it did allow me to, you know, do more in my personal life. I also ended up buying a house here in Prince George's. I'm proud to be a Prince Georgian now for the past couple of years, and that was a whole change. I was also I also switched jobs, and so that was a big change. And so I was filling the space more and more with things. And so again, I don't think I necessarily experienced compassion fatigue in that, like, I was always ready to show up to my job. Some days it was hard, but I think it was inertia. Like, I was moving and it just kept me moving. And only in the past couple of months have I really been able to like take stock and slow down and reflect on things. And I think that only in the past couple of months have I realized, wait, I need someone to help me too. Like, because I was going through all these changes and just like expanding to fill the space, like, and it was all related to other people, I really didn't look at myself too much. And so now I feel like I'm playing catch up on some personal work. So I also started seeing my own therapist and taking better care of my own mental health, and processing things that I hadn't even processed, like from prior to the pandemic. I had lost my mom before the pandemic, and I'm kind of glad she didn't see it because she worked in a hospital too. So that was unprocessed. And so only now am I realizing, wait, like, the cup is overflowing. You literally can't add any more in. It just keeps spilling out. I was telling friends recently, I've forgotten or just missed several appointments in the past couple months. Like, not because they weren't in my calendar, not because they weren't important, not because I hadn't thought of them even the hour before. They just evaporated out of my consciousness. And so that too is like, whoa, press the brakes. So I think in a sense, because I was moving because of the inertia and being so focused on other people's mental health, that I really didn't feel like the trauma. I knew I had to like just keep a wall up so that I could keep doing my job. I don't think I felt as traumatized as maybe some other folks have felt. But now that I'm able to slow down, now it's taking the toll. Now I'm feeling the tension, the physical effects. And so now I'm really having to focus on taking better care of myself, because it does eventually catch up to you. You can only like keep things out for so long before it really catches up to you. But I do think that through it all, my experience with to be able to empathize with more people has increased. Part of the personal like growth that I experienced in wanting to meet people's needs, especially people mentioned like the cultural, racial upheaval during this time, like doing a lot of reading and reflection myself. So I think I have become more of an empathic person again towards others, but now literally in the past couple of months, I'm learning to do that towards myself. And I think one of the best things that has actually helped me take better care of myself has actually been a series that I do once in a while with the Maryland Department of Health called Helping the Helpers, where I talk to other frontline workers and medical, all kinds of healthcare people about simple, stress management strategies related to the pandemic. And they say, teaching something is the best way to learn it. And so as I have taught more and more of those classes, I've started to adopt some of the strategies myself. And telling stories is one of the strategies that really helps with stress management. So again, I'm also grateful to have been able to speak now just to tell my story. I guess other strategies that I've used, physical activity has really been helpful for me, and that's been one thing that I think that I added that doesn't need to go away. So that was nice. Before the pandemic, I never had the mental space to create a routine around it. And again, I keep saying that routine's so important for mental health in a lot of ways. And so yeah, developing a routine around physical activity has been very helpful. I bike to work because I'm lucky to live close enough to the campus in College Park that I can bike there. So, and I jumped on the Peloton bandwagon. So, so anyway, that's been helpful to build routine. And yeah, my hopes for the future, I think hopefully that now that I'm more motivated to take care of myself, that I can incorporate not just the routines of like my social life and physical activity, but really get my own mental health routines in order. I had some routines before, I had some of like the social connections and other habits, but they weren't enough. And I can tell that now that, I was doing too much. I am doing too much, focused on others, and it's time to slow that down. I'll be better able to care for others when I got my own house in order. So, but I'm very hopeful about that. I feel renewed in my commitment to myself. So definitely hopeful for the future.
Yay. Thank you, Alex. Thank you. And we hear you. We hear you. Okay. Oh, we're going to have our next speaker, who is Kawana Cohen Hopkins.
Hi, thanks so much. And thank you to NAMI for inviting me here tonight to speak about my experiences as a frontline worker during COVID. Professionally, I'm currently the Director of Population and Community Health at MedStar Southern Maryland Hospital Center in Clinton. I've been in this position since March of this year, but was the Assistant Director since last April. So initially, the focus of my position was on COVID vaccine administration across Southern Prince George's County. We started out in the big white tents out front of Southern Maryland Hospital Center. Once the need for vaccines sort of decreased, we focused our efforts in implementing broader community health programs across Southern Prince George's County, with a particular focus on chronic disease prevention and management, cancer screenings and awareness, and mental health resources. So Prior to becoming assistant director at Southern last April, I was an ICU nurse at Washington Hospital Center for 10 months in the middle of a pandemic. And this is really interesting because nursing is a second career for me. I served as a biologist in the federal government for 16 years prior to becoming a nurse and going to nursing school. So what a time to change careers. Well, who knew?
Who knew?
So, who knew? So prior to COVID, like I said, I transitioned from a career in the federal government to nursing school. Nursing school was definitely one of the hardest things I've ever done in my life. And the difficulties of nursing school took a toll on my home life. I spent most of my time studying or in clinicals. I went to the University of Maryland in Baltimore, and I lived in Prince George's County. So the commute alone on a weekly basis would almost kill me. Literally, I'd almost fallen asleep at the wheel a number of times from classes, clinicals, and just being in the library. It took a huge toll on my home life. And so I rarely had time for family and friends. And like I said, prior to nursing school, I worked in the federal government. My last position was as a section chief at FEMA. So I was very active in my work. I had a staff of 15 people. I enjoyed it, but the passion wasn't there. My passion was in community service. And so along with my position at FEMA, I served in a number of community service capacities as a member of the Fort Washington Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and as a member of the Bowie-Mitchellville section of the National Council of Negro Women. So within both organizations, I held leadership positions and coordinated outreach events. And on top of that, I now have an 8-year-old son, but at the time, I was an active team mom on his lacrosse and his football team. So I was a busy person. At the time, but COVID changed all of that. So when COVID began, I was in my last semester of nursing school. And so I was doing my practicum in the ICU at Prince George's Hospital Center. And once COVID started, they kicked all of us out because they just didn't have the time, energy, the PPE to even focus on students and to precept us properly. So we wound up going virtual. But prior to that, literally a month before, I had already accepted a position as an ICU nurse upon graduation. So in my mind, I was gearing up to join the fight. Right. And so most of my classmates, we were all gearing up to join the fight because we saw nurses as heroes at the time. But we had no idea what we were stepping into. It became very, very apparent once I landed on the floor in July of 2020 that, this was a very, very difficult space. In addition, my home life began to suffer. My son began Zoom school. He was only in kindergarten, so that was really tough. And I began the process of going through a divorce with my husband of 12 years. So that on top of jumping into a new career in the middle of a pandemic brought about a whole other level of anxiety, not just for myself, but for my classmates, because we were in a space of uncertainty. Were they going to allow us to graduate? Did we have enough credits? Would they allow us to go on the floors if we didn't finish out our practicums? We were really unsure how things were going to work out, but the needs of the hospital necessitated that we join the fight and join it early. So a number of us were actually able to graduate about a month early. So I actually graduated and finished all my classes and credits in April of 2020, officially got my diploma in May. And before my bridge program at Hospital Center started in July, I worked at the Convention Center in Baltimore and assisted with COVID patients there. So to come from a space where my familial relationships were already impacted by nursing school to move into COVID, where I was a nurse in an ICU, was extremely difficult. The pressure in the ICU was very high for everyone, but especially for new nurses. I was exhausted from the training and just from caring for patients that were very, very acute. And I mean, their status would change like that, and also going through the highs and lows of COVID. When we came in July, we were kind of going through a lull. And then right before Halloween, it was like, we were in the throes all over again. So it was a really, really difficult space to get your footing as a new nurse. And there are always trials and tribulations as a new nurse coming into any level of hospital care, be it the floor, ICU, PACU, ED, it doesn't matter. It's difficult as a new nurse to understand and get your footing in the profession, but then to have to deal with COVID on top of it was a whole other animal that other nurses, they had not experienced in that way because they were already experienced, you know? So to be able to have to precept us, teach us, make sure that we're not making medication errors, that we are confident and competent in our abilities was really, really difficult. And it was a very anxious time for all of us. I think the magnitude of COVID really became clear to me once that surge went through in the fall, winter of 2020. And in that time, I felt really fearful and helpless. I mean, I was coming home to a child and to, you know, a relationship that was ending with someone who was immunocompromised. And I was in and out of COVID patients' rooms all the time, working 12 to 14-hour shifts. I had to change my clothes in the garage. I had to take showers essentially with Dial in on the unit, change into another pair of scrubs, go home, change again in the garage, and then rush upstairs to take a shower and, you know, kind of cleanse myself. So you felt helpless. And again, as a new nurse, you're also doubting your skill set. So it was really, really tough on all of us. I think in that space, I probably worked harder than I ever had in my life. I thought nursing school was hard, but ICU nursing in the middle of COVID was definitely even harder. And physically and mentally, I was exhausted. There were some days where I did not eat. I lost a whole bunch of weight between Donnan and Dolphin, plastic PPE, and living life. And an N95 for 14 hours on edge and having, you know, the marks on your face and just being mentally exhausted. It was just a very, very difficult time. But I would say the thing that helped to bring me through that was that I knew I was not alone. I had a cohort of 57 new nurses to come through with me in ICU Bridge. So on my unit alone, there were 4 of us that were starting in the ICU as new grads. But we had other friends, if you will, that were on the medical ICU across the hall from us, upstairs on neural ICU, down the hall in it's called MedStar Heart Institute, and, you know, all over the place, and ED, new ED nurses. So we would have our little brunches. If we worked night shift, we'd leave, go to brunch in DC, and just kind of have it out. And I mean, that camaraderie honestly saves all of our lives in the midst of it, because you really feel like you're starting to lose yourself and lose your marbles, and you're unsure of yourself all at the same time. It's a lot to deal with and to endure alone. So it was good to know that we were not alone. We had each other, and, you know, we supported one another. And there were times where, you know, some of my colleagues would say, or some of my cohort mates would say, I can't do this anymore. I'm going to leave the bedside. And, you know, we would say, okay, it's okay, and support them through those decisions. Because, I mean, we had all taken an oath to come into this space. We had worked really hard to move into this space. And I mean, working at hospital center was coveted. You know, I remember meeting people during interviews from across the country who wanted to work in ICUs at hospital center because it's a level 1 trauma center. You don't get to see those types of things at, you know, certain hospitals in other parts of the country. And here we are getting these opportunities and then feeling like, I can't do this, you know? So it's a lot on you mentally. Personally, again, it was really tough. Not just with COVID, but with the social unrest. I mean, I got to the point where I had to avoid the news and social media. And I literally had to just say, you know what, I've got to put the phone down. I couldn't do it. I wouldn't post anything. I wouldn't mindlessly scroll because it was too much. I mean, you're dealing with what you see on TV in front of you at work. So then to come home and to revisit that, it got to be too much. And it was a really, really tough time. The thing that I would say that COVID has done on the positive side is that it created essentially this position for me and a place where I could combine my nursing, background with my community outreach background. And so that's given me also the opportunity to expand the programs on our team and build our team up and bring in new team members who were once bedside nurses themselves, who were more interested in working with patients to reduce their risk of coming back to the hospital. And that's been phenomenal to be able to work on partnerships where initially a lot of our partners, we became partners because they wanted to do vaccine events. So again, COVID kind of cracked the door for us, but in that space, we've been able to establish partnerships to do longer term programming like blood drives, cancer screening events, blood pressure screening events, you know, and educational events in Southern Prince George's County. And that's been really, really great. What else can I say? Again, the changes that I experienced in the pandemic was increased anxiousness for sure. I'm generally an extrovert. I love talking to people, but I found that in that space on the unit, I would not talk to my colleagues because I was just so unsure of myself and so uncomfortable and very, very anxious about what they thought about me in this space. So that took a deeper toll on me. And like I said, I lost a lot of weight. So that was interesting because I love to eat, but you know, couldn't eat. You just didn't have the time. So how did I deal with the increased stress? So I did start to eat, first of all. That's very important for, you know, just the mind, just to make sure that you're leading a balanced life and having a balanced meal. That was first things first. But I did start to exercise more. I got back into running, which I had put on pause while I was in nursing school because I just didn't have the time. And it's where I found just my peace, just, you know, running in the park among the trees and just taking in nature, especially during COVID when not that many people were outside, was actually really, really great. And I started seeing a therapist, and he has been phenomenal. And I mean, I've had therapists in the past, but what I noticed with COVID is that they were all booked up. And so it was really hard for me to get an appointment. To be honest, but I had a friend who had a therapist previously, and he was available, and he has truly, truly been a lifesaver. So that, and then my friends in healthcare, because we can all relate. We understand what it's like to, you know, have a patient who somehow gets out of their restraints and pulls their intubation tube, and you're like, what the heck? And all of a sudden you're in a code. So we were able to relate to one another in that space, and, you know, just kind of support one another to get through the tough times. I would say the thing that I hope that comes in the future is just that other healthcare workers know that they're not alone and that they support one another through these tough times. The surges, the changes in policies, the changes in mask mandates, the, you know, conspiracy theories that we have to face when we go out into the community, and all the questions that we get from family members who want to know, well, you know, what do you think about this drug, and what about this vaccine? You know, just lean on each other and know that you're not alone, and really support one another in that space. So that's all I got.
Thank you, Kawana. Yes. You sure allowed us to see and envision your juggling act, because you was juggling all along. Our next speaker is going to be Natalie Bollinger.
Hi, thanks so much for having me. And I just want to take a quick moment and say thank you to everyone who is has been and is still doing in-person work. I'm a social worker, and I work for Beacon Health Options. We're a managed care organization. We cover medical assistance, behavioral health coverage. So I've been remote prior to the pandemic, and it's been a long time since I've been face-to-face. So while my job certainly has its issues, and as you'll hear from my story later, I just want to thank everyone who's still doing the in-person, because it's a whole other level of frontline work. So I just wanted to say you're very much appreciated. So I initially was on the frontline position in our clinical department, and I eventually moved to a supervisory position. The frontline position consists of taking direct member calls for, like I said, behavioral health referrals, crisis calls, as well as talking to our providers, both hospitals and outpatient groups. So before COVID-19 happened, you know, my days looked what I believe to be pretty standard. My mornings were made up of getting my kids ready to get to school. I got them on the bus, and then because I worked remotely, I came back in and I went up to my home office and I started my day. I'm a very social creature, so on the weekends, since I worked all week in my house, I really enjoyed getting out, meeting friends for dinner or going out with my family. It was definitely common for me to meet my best girlfriends like once a month for dinner. It was kind of routine, like Dr. Chan was saying, was pretty important. And as a family, we all love spending time with our friends. So we would either invite friends over to our house or we would, venture out to visit. So I remember when COVID began. I remember the last time my kids got off the bus in March 2020. They were very pumped. They were excited to be home for 2 weeks because that's just how their little brains work. They were 6 and 8. And it was a little bit scary, because Beacon Health, because my company was remote prior, my work life continued as usual, except there was the addition of my 2 children either playing or fighting outside of my office, depending on their moods. And I will say we are really fortunate. We live out in kind of a rural area, so we have a little bit of land. And it just so happened to be a really beautiful spring. I don't know if anyone remembers, but we were able to just be out in our yard and kind of utilize our space. So it wasn't too terrible. But, my husband and I were definitely very anxious about the pandemic, about what that meant and how it would impact our world. But we really tried to keep things pretty typical and calm for our kiddos. It really hit me, the magnitude of COVID and what was going to happen in the next year or two when the schools became virtual. So, it was really frustrating for me with my children's education. My son, who was in kind of a pivotal year, all of his education became online. Obviously through no fault of the school, they did the best that they could. But he was learning things from educational sites from people he didn't know. My daughter ended her kindergarten year virtual. It really impacted her very newly formed friendships. So she kind of reverted to referring to her preschool friends as her best friends, and she didn't really know anyone around here. So that was frustrating. I tried to keep a really positive perspective most times. I'm a glass half full kind of gal. So I tried to focus on gratitude just for our health. The fact that my husband and I were able to keep our jobs, that was huge. And again, for our space, but it was tough. So the last couple of years during COVID and just like everything that's happened in the world, it's definitely had an impact on me in various ways. Personally, my place of worship has changed due to, in part with COVID, I disagreed with their masking policies. And as well as I wasn't overly thrilled with how they handled the death of George Floyd. And so that was just kind of the push for me to find a space that resonated with my beliefs. Who my husband and I and our family interacted with in our community definitely changed due to different views on COVID. Many in our community returned to having indoor gatherings a lot faster than we did. They were less strict with their masking policies than we were. So while we tried to maintain the relationships, we didn't participate in as many gatherings. So it definitely increased frustration, sadness, anger, especially for our children, because they, would hear about family gatherings or friends that all got together and that we didn't participate in because we didn't feel comfortable. So, we tried to have honest but respectful conversations with them about what differences of opinion can look like and how we, can still love one another but keep our boundaries. So it was interesting, to say the least. In terms of work changes, from the very beginning of the pandemic, my company initially took the initiative, to do outreach calls to individuals who had recent treatment episodes, which I thought was really helpful. It was really well received. And to just kind of check in, we wanted to make sure that there weren't any issues accessing services with the shutdowns. And if there were issues accessing needed services, we tried to help be a bridge for that. We saw an increase in need for services within the community. I think someone else mentioned, I forget who, but people who had no real history of needing or wanting to reach out for services, all of a sudden we're calling and saying we don't know how to navigate this. We also had an increase in individuals wanting to see practitioners that looked and sounded like them with all of the social issues happening. And especially in some of our rural counties, that provided a challenge. So it all led to days that felt more intense. We had individuals who had call-offs because their children were quarantining from school and they had to be with them, or they were sick themselves. So it just led to work days that felt longer, more intense, and frustrating overall. What was good with my employer, we're behavioral health managed care. So if anyone should be caring for their employees, it's them. And they've done a great job in terms of, at first they added additional time off for COVID related issues, whether it was you or a family member who had needs. So that was helpful. It just gave a little bit of a cushion. And they've also been encouraging self-care and still are bringing it up in discussions, not only from the top down, but just, in everyday conversations. To try to work on that compassion fatigue, because it's real and it's definitely been experienced across the board. I can say that, I've experienced it myself due to the COVID issues, and like everyone else is saying, the conspiracy theories, the social justice issues in our country right now. My family and friends have been grounding forces for me. Those closest to me are really highly compassionate individuals, and we've been able to kind of commiserate through the ups and downs, and those social connections have been really important to me. We've had to make some changes. I personally made some changes for myself. I've heard other people say that they've reached out to get their own therapist, which is great. When my children in the 2020-2021 school year went hybrid, I think I made it about 2 weeks of them being hybrid and me working virtually. And I called my PCP, who I have a really great relationship with, and I said straight up, I said, you got to give me an antidepressant. I don't care what it is. You got to get me on something. So I just recognized that my agitation was really high. I had very little patience. I wanted to isolate, which is really not how I am when I'm doing well. And it was funny, after I started to take my antidepressant, I didn't realize I felt like I had a jagged edge inside of me, and it was gone. Or if not gone, it was much muted on the antidepressant. So that was really helpful. So in terms of the compassion fatigue and the stress and my self-care, I try to work out 3 to 4 days a week. I'm also on the Peloton bandwagon, although I don't have an official bike. I just use the app and an old bike I had. But I try to cycle. I try to walk if it's a nice day. Music is really important to me. So it can be very soothing music, or I can be blasting music and basically screaming in my car. But that's a very therapeutic tool for me as well. So, and I'm still very diligent about taking my medication every day. In terms of positive changes that have occurred during the pandemic, my nuclear family has remained incredibly close. I would say my closest relationships have been strengthened during this time. We've viewed the pandemic and our responsibilities really as humans much the same way. There's a few families that we actually got to a point where we kind of had like a pod mentality, which was nice because we knew that they had similar mindsets and they lived their lives in a similar manner. So we didn't question if we were going to be safe if we were in their homes, and vice versa. So that was really helpful. Resources that I found to be helpful during this time, I really strongly encourage everyone to have a PCP. I feel like it's becoming less common. People just go to like MedExpress or their urgent cares, and they don't get to have that relationship. And I think it's really important because I think they're a great base for support, and they're able to, of course, help you with the general health concerns and then refer you out when it's needed. So I think that's really important. Also in my job, we try to access as many resources as we can for individuals. The website, if you search Aunt Bertha, which I hadn't heard prior to the pandemic, but BERTHA, it takes you to a Find Help website. And it's fantastic. You just put your zip code in and a whole number of resources come up, from food pantries to support groups to legal aid. So it can be really, really helpful. And in terms of my hope for the future, like I said, I'm a glass half full kind of girl. So I really try to remain focused on my goal of helping others. That's why I got into social work. No matter what opinions are floating around me or what policies change, if I can try to remember that I got into it to help others, and that even the little things that we're doing are making an impact, you know, small or big, it keeps me going. So my hope is to just maintain my focus on the mission.
Thank you, Natalie.
Thank you.
Each and every one of you. We have one more frontline worker to share. She can't get her camera on, but if you could just hang in here with us so that we can hear her story. Her name is Maureen Enzy. Maureen, are you there? Maureen?
Can everyone hear me? Good evening.
Yes, good evening.
I was like, I have camera issues. Please don't tell me I have microphone issues too. But good evening, everyone. I am so glad to be with you all. And I just want to thank NAMI Maryland for inviting me to be panelist for this presentation this evening, this event. So COVID, oh my God. Graduated nursing school August 2019 from Johns Hopkins School of Nursing, and I was ready for my first year that I had heard about. You know, the first year as a nurse is never easy. There's so much to learn, and you know, it's challenging. So I was bracing myself for the first year, you know, ready to take it all in. And 5 months into my first year, it's like pandemic. I was like, what? So that just threw everything into like total chaos for me. But it was pretty challenging. Personally, I had a lot going on in terms of like personal relationships, stressors involving that. And then professionally, just learning a new role, first as a registered nurse and then as an acute dialysis nurse in an inpatient hospital here in Maryland. I worked at 2 hospitals, so I was like, you know, back and forth, and we provided dialysis treatment for patients that were hospitalized. So with COVID, it was pretty interesting because there was an increased number of patients for some reason that needed dialysis during COVID. And what made it pretty challenging for us was that, you know, the ICU nurses, like, you know, they'll set up their machines and everybody will, you know, all the nurses will run out. But we had to be the dialysis nurses because the machines had to be in the room hooked up to the patient. We had to be in there, you know, so we had the mask on and everything, but we had to be in those rooms 3 hours for the treatment, setting up, tearing down the machine. So given like 5 hours, you're in the room with a COVID positive patient, you're breathing in all that air, and all the other medical professionals, they just like dash in and dash out, or they're like handing you stuff. Oh, please hand this to the patient. And then you're looking at yourself like, okay, so I need to be in here and I'm the little errand girl, you know, for you all. So that was a stressor. And then, you know, being in the room with the patient, yes, you know that you're providing a life-saving service that is very, very needed, but you know, it was all of those kind of stresses. And then just working very long shifts, you know, as one of my colleagues already mentioned here. I remember a particular day I worked 20 hours. I got to the hospital at 6:30 and I did not leave till like 2 a.m. you know, in the morning. By the time I got home, I was exhausted because, again, there were many, many more patients who needed dialysis treatment. For some reason, a lot of the patients were not comfortable going to the outpatient clinics because of, you know, fear of getting COVID or whatever. So they'll miss the dialysis patients. So you can imagine there was a high rate of patients needing dialysis, first from COVID, complications due to COVID, and then from just regular dialysis patients not going in for their treatments out in the community. So that was pretty stressful. And then, just the fear of, bringing COVID home to family, to loved ones, dealing with social isolation. That was pretty stressful, and just dealing with the isolation was tough. It was very tough for me. And also just seeing, people die, people pass away from COVID. It caused a lot of trauma, sleepless nights. I remember a particular day, I had to give a treatment for a nurse. She also was a nurse, and had the machine set up, and before I knew it, I was told that this young lady passed away. So just seeing the deaths, passing, in front of the patient's rooms, and seeing either the candle lit or just, I don't know, it was just sadness and despair that was taking a toll on me. It was taking a toll on me, not just on me, but on my colleagues. So the morale, burnout, everyone was just exhausted. You could like hardly call out. Your supervisors needed you. So there was that, compassion fatigue. You felt like you needed to be there. You needed to, put in your own fair share of work, and, you felt guilty calling out if you know that you were needed, you were tired, and, so all of that was just pretty stressful. And then just dealing with, I remember a particular day, my supervisor called me on a Sunday. I was like, wow, on a Sunday. And so she said, oh, Maureen, I have something to tell you. One of the patients that you provided dialysis treatment for yesterday, Saturday, yeah, her results said negative, but actually we did another test and her result came back positive. So those kind of things, there was a lot of fear, a lot of anxiety, a lot of apprehension, what is the true status of this patient? So those were, real strong feelings that we were experiencing at that time. It was pretty hard. It was a very, very challenging time for me and for my colleagues. And watching the news did not make it any easier. So I personally made up my mind after a while when I saw the number of cases going up, either morbidity or mortality going up. I had to make a personal decision to just avoid the news altogether. I mean, like, I might log on to social media, Facebook, and, for a minute or two, but like, sit in front of the TV, watching the news, all of that. I had to get to a point where I said that wasn't helping, because what I was dealing with at work in the hospital was taking a toll on me already. And so just that, added source of I'll call it negativity, was not helping. So for my own peace and for my own sanity and just to keep me going, I made that decision. So that was one strategy that I used, as well as, prayer, journaling, using those coping skills to just help me navigate that time. It was pretty challenging. And then also dealing with the skepticism regarding the vaccine and all of that, what was going on regarding the pandemic, the source, and some people not wanting to get the vaccine, family members not wanting to get it. All of that also did not make navigating the pandemic easy. So I worked as a dialysis nurse during the pandemic, and I also worked as a psych RN. Psych is my passion. So I currently work as an outpatient psych nurse in DC, where we provide mental health services for adults with severe mental illness and substance use disorders. And so just watching them navigate the pandemic too, a lot of the patients have not been to the doctor in years, have not had physical in years, very apprehensive of going out. So just being there to support them. Some are still very skeptical about getting the vaccine. So a lot of education, trying to understand where they're coming from. Some of them are coming from the background of social injustice, dealing with stuff regarding history with the Tuskegee. And so just, you're dealing with your own self, and then you're trying to calm the fears and reassure, educate others, family, patients, co-workers. That too poses a challenge. And so for me, what the future looks like for me, I am looking to start a DNP program in psychiatric mental health nurse practitioner in August. I'm looking forward to starting that to continue my passion in mental health. I am very, very passionate about mental health and working with patients with mental health and chronic medical conditions. That is really my niche. I like coordinating care for that population, especially in rural communities, underserved populations. That is really my heartbeat. I've been working in DC since 2010, and I'm back working there full time. I do dialysis on a PRN basis right now. So I look forward to growing personally and professionally as I begin my DNP program in a few months to continue serving the population, especially those that are affected by mental health, substance abuse disorder. So I'll just continue to encourage everyone, frontline staff. It's not easy. I've been in there going through it still. Let's just remember our whys, why we got into our different careers. Let's keep the faith. Let's stay strong, stay positive, reach out for help when needed, and just keep moving forward. Thank you all.
Thank you, Maureen. Thank you all, each one of you. Danielle, it's yours.
All right, well, thank you everyone for joining us this evening. This virtual event has been recorded and will be emailed to all registrants tomorrow. For any individuals who are unable to register, the recording will also be uploaded to our website at namimd.org. At the end of the event today, you will be asked to complete a short survey on the aspects that you thought were helpful, could be improved, and what you would like to see in future events like this. We plan to continue hosting educational webinars and Voices of Experience events, and this survey will help determine how we can best support you during this time. NAMI Maryland offers many virtual trainings and webinars like these to assist frontline workers and help them handle the ongoing stressors of the pandemic. We've developed more than 30 free educational webinars and fact sheets for a wide range of audiences, covering important topics like resiliency, self-care, and building support. You can learn all about these webinars and fact sheets on our website at namimd.org. We can only offer these webinars and events free of charge because of the dedicated support of individuals and organizations like yours. The rising need for NAMI services means we need your help now more than ever, and we invite you to join us for our 2022 NAMI Walks Your Way Maryland campaign. NAMI Walks is a several months long campaign that promotes public awareness of mental health, reduces stigma, and supports our mission of recovery-focused support, education, and advocacy for individuals and loved ones affected by mental health conditions. The campaign will build on last year's success and will continue to explore and expand on the positive ways the arts impact mental health. We're excited to share that this year will be a hybrid of private and virtual in-person events that will include a virtual opening ceremonies next Saturday, May 21st, and an in-person invite-only VIP wrap-up party on Saturday, July 9th. The first NAMI Walks took place in Maryland 20 years ago, and we invite you to celebrate this milestone with us as a participant for this incredible campaign. You can learn more about NAMI Walks and register for free at namiwalks.org/Maryland. For additional resources or support, please visit our website at www.namimd.org or call our office at 410-884-8691. Thank you all so much.
Danielle, did you want to share the audience question or their comments?
Just a couple of very sweet comments from the audience. Claudia says, you all have done amazing work supporting everyone. I'm in awe of your dedication and commitment to your profession. Thank you all for sharing your stories of lived experience. I've learned a lot and appreciate your transparency. You guys are all my heroes. Take time to take care of yourselves.
Yeah.
Beverly says, thank you all for sharing. Patricia says, outstanding, and thank you for direction, guidance, help, support, and commitment to mental health.
Thank you.
Thank you all, and have a wonderful rest of your evening.
Thank you.
Thank you.
Thank you.